Hi, welcome to the Falls and Balance Workshop, where we talk about what encompasses balance. What are the different elements that are required? Because it's really a big subset, right? And then what can we do to help improve that to reduce the risk of falls? So before we get started, just a very short thing about me. I'm Michelle. I've been a physical therapist for about 32 years, and I've worked with the geriatric population for most of that time. And I've seen a lot of falls, seen the results of falls, and it's not a pretty picture. So, my goal today is to help educate, help you understand what goes into balance, what we can do to help improve it so that we can avoid those falls and any injuries that come of it. First off, I want you to think about what your story is. In the live workshop, the people present were sharing their stories about what brought them to the workshop, what they've been through, some of the challenges that they've had, some of their fears of falling or their experiences and how they've dealt with it, and a little bit about what they're hoping to accomplish and improve upon. And what I tried to reiterate with them also was not just to think about the goal of being stronger or feeling steadier on my feet, but to think about what's the big picture? Why do you want to improve that? Generally, the long term answer is so that we can be independent, not rely on other people, live a long and active life. So there's just more to it than just being stronger. So, why are we talking about balance? Why does it matter? Well, obviously, the statistics are not great, but we're not going to go deep into those. Those are kind of scary things, right? I could tell you a lot about how much money is spent every year from injuries, the mortality rate after falls, all that scary stuff. But today, this is about empowerment. I want you to feel empowered to take care of yourself and reduce the risk of this ever happening. Because the worst thing you can have is a fear of falling, because that actually increases your risk of it happening. And even after a fall that doesn't result in injury, it can still have those negative effects. Once you've fallen once, your confidence starts to whittle away. And when that confidence goes down, you start doing less. You're fearful of it happening again, so you stop doing the things that cause that fall. And then that leads to stopping or slowing down other activities, things that you really enjoy doing. You start giving up hobbies or sports. And then ultimately, you start actually having difficulty doing activities because you're not doing them anymore. And then you start relying on other people. So even if there's no injury, just having a fall can lead to this cascade of events. Of course, we can't talk about falls without discussing the risk factors in the environment. One of the easiest things for you to manipulate are the things in your own home. Do you have these beautiful rugs that you just can't do without that also bunch up and cause people to trip? Do you have poor lighting in your home? Do you lack the stair rails? These are all things that can be manipulated, can be fixed. I'm not asking that you give up your favorite rug. I understand those make a difference. We enjoy the way they look, but make them safe. You can easily put some double-backed tape under that carpet, kind of cinch it down. The main thing is to make it safe so it's not a big trip hazard. Adding lighting is quite easy. Little night lights that come on during the dark so that you don't have to worry about turning on lights if you're up. And stairways. Add a rail. Just make it easier for yourself. Obviously, if you're building a home, that makes it even easier. And if you're under 50 and building a new home, Think about what it's going to be in the future. Don't think about how you're moving now. Think about what you might need 10, 20, 30 years from now. When I built my home with my husband, he put rails all around our walk-in shower so that when I got old and decrepit, I would have some rails to hold on to. Thinking ahead. Our stairway, we have 2 rails, one on each side. What if I had a stroke and one side doesn't work? I'm going to need a railing on either side. So these simple little things can be quite effective. Another thing is the footwear. Obviously, wearing something that stays on your foot is important. A lot of people wear slippers around the house. I just had one lady who tripped on her own slipper because it was so loose, it slipped off, and then she tripped on it, broke her hip. Something as simple as that, and people will say, well, I've never tripped in them before. Well, it only takes once. So minimize the risk. Wear shoes that fit. Now, when we talk about balance, it's a multitude of symptoms, which we'll get into. And the important thing here is to understand that they all work as a team. You can't rely on just one. Just like a stool, if you were to take away one of the legs, that stool is not stable. Same with our balance. If we lose one of our systems, the others have to work harder and they may not be able to keep up. So it's important that we work on all the different systems to improve our overall balance. These are the 4 main systems that help keep us upright. Vision, obviously what we see, but beyond the actual vision of is it blurry or is it double or just, 20/20 versus 20/50. It's about how your vision, how your eyes send the signal to the brain and how the brain interprets it. We call ocular motor control and how they work in tandem with each other and with the brain. There are people who have issues with depth perception, with movement, so that when they're moving in a crowded environment, their brain cannot process all that extra stimuli, and it actually makes them dizzy. The vestibular system is what we think of as that inner ear, right? If you have motion sickness, that would be part of your vestibular system. There's also an issue in the canals that are caused by little crystals. You may have heard of BPPV, benign paroxysmal positional vertigo. If you have dizziness with certain head movements, particularly up and down, maybe you get dizzy every time you go to put something up in the closet or every time you bend over to pick something up, that would be one type of BPPV. If you get dizzy primarily with rolling or simply turning your head side to side, that's a different form of BPPV. So there are several forms in addition to that, but that's something that can be fixed. There are some therapists, including myself, who are trained in how to get those crystals out of those spots so that you don't have that effect. Somatosensory system is our ability to feel from the bottom of our feet so that our feet can send signals to our brain if we are standing on uneven ground, if you're standing on a rock, things like that. But also proprioception from your different joints and muscles that tell the brain where your legs are in space, where your arms are, where your body is. Every movement that we make, the brain gets that signal and can adjust. So if I were to start to lean over one way, the brain gets that feeling and it adjusts and alters my posture so that I don't fall over. Strength and reaction time, they kind of go similarly hand in hand. Strength is obviously your power. Reaction time is your ability to respond and use that power quickly. You might know it as agility. If you have good agility, you're going to likely have good reaction time, catching yourself if you were to stumble. But balance changes over time. As we age, things happen. While some of it may be due to just actual age, things breaking down, I think more of it is because we just tend to slow down. Possibly due to retirement, right? We're not going out working, doing things like we used to. We're not keeping up with the kids. We're just slowing down. Hey, it's retirement time. It's time to take it easy. But when we do that, we start losing strength and flexibility, stamina. So slowing down in our golden years really just leads to more problems. It's important to keep moving. If our strength goes down, if our reaction time goes down, we're more likely to fall. Now, one of these is not necessarily in our control, and that's the medications. But if you are taking a medication that you feel is impacting your balance, making you feel dizzy or just unsteady, that is definitely worth a conversation with your doctor. Let them know. Maybe there's another form of the medication that they can give you, a different dosage. Don't just chalk it up to, well, I have to take it because the doctor gave it to me. Have that discussion. Maybe it's not worth it to take it. Who knows? But ask. There's some simple little self-checks that you can do to see how you stack up. Obviously, in therapy world, we have a ton of different tests that we can do with people. This is just a small sampling of what you can do to kind of self-assess yourself. I don't want you to think about it as a pass or fail, just checking in, see where you stand. The first one is standing up and down from a chair without using your arms. If that's too difficult, go ahead and use your arms. Do what you can. Just try not to use your arms any more than you need to. If you were doing it truly without your arms, standing up and sitting down from a regular chair, I would expect that you would be able to do this somewhere between 10 and 15 times in a 30-second period. If that's too difficult, start small. Start using your arms. Raise the seat a little bit. Do it from a higher surface, from the edge of your bed, whatever's safe, but start working up. Do a few at a time until you can do multiple at one time. That's going to help strengthen up mostly your thighs, as well as work on balance, because you could be as strong as an ox, but if you don't have your mechanics correct, leaning forward, getting your weight over your feet, you'll still have issues. The second one is a heel raise test to strengthen your calves, or in this case, to check the strength of your calves. And it is done with one leg at a time. Obviously, if that's too difficult, raising both heels at the same time is perfectly fine. But if you really want to make sure that you're strong and stable, do this self-check, hold on to a countertop or a table, something sturdy. And if you can lift one leg up, go up on the other toes and see if you can raise that heel up nice and high. See if you can raise it 25 times. The first one and the last one should be about the same height. Again, if you can't do 25, do 2, do 3. You do you. Do what you can and work on it. It can't hurt but to get better. The last one, standing with your eyes closed, obviously doing that somewhere safe where you are protected, but this takes away that visual input and it helps to bring awareness to see if your inner ear and your somatosensory system are working as they should. If when you close your eyes, you immediately lose your balance, that's a strong indicator that there's some issues going on. You are very vision dependent and it's trying to take care of everything when your other systems are weak. Reaction time, super important. for those times when you do have those near falls. Think about a time maybe when you tripped over a crack in the pavement, or you went to turn quickly and you kind of lost your balance. If you have good reaction time, you can stop yourself, because really falls are inevitable in a sense. I take that back. Not falls, but loss of balance, let's just say. Right? It happens. You get nudged, you trip over something, maybe you kind of turn funny, and we all lose our balance a little bit. But if you have the good reaction time and strength, you can catch yourself and not fall. So that's what we're shooting for. Falls could happen, but we want to reduce those risks. Now let's talk about your feet. Feet are your foundation, right? They hold up your whole body. So it's really important that you give them the love and care that they deserve. Your feet have tons of sensory nerves at the bottom. They provide a lot of input to your brain to tell you how you're standing. Are you standing on a level surface? Are your feet flat? Are you kind of going side to side? They tell your brain a lot, and that sensory system works all the way up. Everything up above your feet gives information to the brain, telling it where it is in space. But if you wear shoes that are super thick, like Hoka's or a lot of these more recent shoes that have very thick soles, what you're doing is you're blunting that sensation, blunting the signal so that the brain can't work as well because it's not getting that full signal, that feedback to your brain about what's happening. So I highly recommend shoes that have thinner soles. Barefoot shoes, that generic set of shoes, are a great alternative to the regular shoe. And there are different brands out there. You will want to try some different ones. If you try one barefoot shoe and you don't like it, please don't assume that you don't like any barefoot shoes, because there are quite a variety out there. But those barefoot shoes are going to give you first a bigger toe box, so that allows your toes to splay out more and get a better grip on the ground. The soles are thinner, which gives it some movement. This is a barefoot shoe, so it actually can twist and turn, so when I step on something that's off, my foot can then bend around it without just falling over. Compare that to walking in a wooden clog. Not that we have those anymore probably, but imagine what that would feel like, right? It can't bend and move and adjust around the uneven ground. So you're very likely just to kind of fall over or definitely lose your balance if you were over uneven ground with a clog versus a thinner soled shoe. So please consider trying something like that and looking into it. So the research is very clear. Targeted strength training, working on the muscles that you really need to get on and off the floor or do your functional tasks, really important. And balance specific exercises. A lot of people who go to the gym, they'll do those, the machines and the treadmill, which is all great, but we also need to target those other systems. It's not just about strength. And I'm a big believer in practicing real life movements. Primarily being able to get on and off the floor, squat down to the floor so that you can reach lower cabinets and shelves. Be able to bend over to pick up objects. Be able to reach. So reaching high and leaning, pushing and pulling doors and cabinets. There are all these functional movements that are critical for us to be able to move safely. So in order to do that, we need to address flexibility, strength, balance, reaction time, and even some stamina. We need to address all the systems. So it's not just a simple workout at the gym. But above all, whatever you do, consistency is key. Doing a class or a workout here and there, hodgepodge, is not going to be nearly as effective as having a set routine. Once a week, twice a week, 3 times a week, whatever you can do. It really is recommended that you address all the different elements 2 to 3 times a week, which means 2 to 3 times a week of working on balance, 2 to 3 times a week working on your strength, 2 to 3 times a week working on stretching, and 2 to 3 times a week working on aerobic or cardio. Now, some workouts get multiple systems, so that's great. Obviously, 2 to 3 days a week of all of those is more than 7 days, but you do a workout that can work in all of those things, so you address it all. These are some myths I often heard my patients tell me, that they just don't move because they think, I won't fall if I don't move. I'll just be really careful. I'll hold on to things. But all that does is result in weakness, less flexibility, less balance, because you're not moving, you're not giving yourself that challenge. This brings up people who start to use devices before they even need to. And that can actually be risky. Especially if you're using a walker. If you think about how you walk normally, we walk with our arms swinging a little bit, our body moves. There's all this motion of keeping us upright. Once you start using a walker, arms no longer swing, the trunk stays rigid. You're probably not going to turn your head very much either because you've got this fixed posture. Only your legs move, and they don't even take as big a stride because the walker tends to get people taking smaller steps. So now you've started using this walker and your walk instantly changes. Now, that's not to say that people shouldn't use walkers. Absolutely. If you are falling, you're definitely unsteady, use a walker. But if it's not time, don't do it. Keep yourself mobile in other ways. If you're not sure, talk to a therapist by all means. But I don't want you to limit yourself unnecessarily, which can then result in that rapid decline. And you know what? It's never too late to improve your balance. It doesn't mean that I can get someone who's walking with a walker to the point where they can stand on one leg. I may not be able to do that, but maybe we could improve that person to the point that they don't have to use the walker, they could use a cane. There's always some bit of improvement that could be made, and that's what we're shooting for. We want people to be at their best. Not perfect, just better. Simple daily habits are a great way to start working on this. Doesn't have to be a long workout every day, just these little things, little habits that you can incorporate into your day. Being able to get up and down from a chair, that's something you could practice. Maybe each time you get up and go get a drink, try a few extra sit to stands. When you're standing at the sink or maybe waiting for your cup of coffee to brew, try lifting up a leg. See if you could stand on one leg, even if you need to hold on to the counter just a little bit. See if you can get one leg up and keep it up for a little bit. Work on those heel raises, whether you do both heel raises together or one at a time, whatever you can do. And my favorite one is being able to get on and off the floor. Whatever your reason, get down on the floor. Maybe you have grandchildren that you enjoy playing with. Get down on the floor with them. If it's not a challenge now, great. Keep doing it. If it is a challenge, make it easier. Get down on something that's higher, or better yet, see a therapist and make it easier. There's nothing better than getting on the floor. Crawling on the floor is a great workout. You're holding your weight. You're working balance. Getting up and down off the floor, obviously, is another way of working balance and strength. So that whole activity is great. So when do you actually need to see a professional? Well, if you've had falls, yes, you need to see a professional. But even if you've had near falls, if you're kind of starting to stumble, maybe you catch yourself, you have that reaction time. But these near falls are happening maybe a little more frequently. A professional input might be good. Definitely if you're experiencing dizziness or vertigo, please seek out a therapist who knows how to work with that. Not all therapists do, so make sure you ask when you call. But there are things that can be done, whether it be the adjustments to move those crystals out of your inner ear or just some what we call habituation exercises. It just depends on what the issue is. But seek out some help for that to iron that out. Neuropathy or numbness and tingling in the feet can definitely impact your balance, right? It's just like having those really thick-soled shoes. You're getting less input. There are things that can be done for neuropathy now, and it's not all medication. There are some modalities that have been very effective in improving the signal in those nerves. And definitely, if you have any type of neurological issue, whether it be Parkinson's, multiple sclerosis, if you've had a stroke and you're not moving as well, seek out input, seek out a therapist. We can help you learn new ways and develop new neural pathways so that you can move better. So, individualized balance training means it's specific to you. A therapist who is specialized in balance can help identify which system is weak. And it may be more than one, right? But we talked about several systems. Each of those needs to be tested separately so that we can identify which one is the real culprit, which one needs it the most. And then from there, we can personalize your program, help you decide what exercises to do, guide you through a good progression so that we can get you to the point where that weak link is no longer quite so weak. And by working with a skilled therapist, we can progress you in a safe manner. People who don't have that guidance and input, they fall into two categories mainly. There are those people who don't push themselves very hard. They're just kind of maintaining. But then there are the people who actually push themselves too hard, and that can be risky as well. You could have injury, you could strain something, break something. So having that input from a therapist who can progress you at the proper rate is really ideal. And then that just builds your confidence, right? You don't suffer the setbacks of doing too much, and you do enough that you see improvement. And that helps build the confidence, which then reduces your risk of falling because you're not as fearful. So these are the things I want you to remember. Balance is trainable. You can do things to help improve those various systems. It's a matter of figuring out which system, and then we can work on it and improve upon it. Falls are not necessarily inevitable. We can work on things to reduce the risk. And just taking small, consistent steps really matters. Those little daily habits that hopefully will lead to bigger habits, bigger commitments, longer workouts, more progression. All these things are going to help. Start where you are now, work your way up. As you do that, your confidence grows and you start moving more and your risk of falling reduces and you're just more likely to enjoy life. We're looking at quality of life. I would much rather you be confident in moving more than scared to move and sitting. So the question for you then is, what do you want to be able to do? If I were to wave a magic wand and I could fix whatever your issue is, what would you then go out to do? What is it that drives you? Why not work on it? Why not work toward that, right? Your health matters. You're worth it. So going forward, you could start with attending a class. Silver sneakers type classes incorporate balance along with strength and flexibility and agility, or other classes at a senior resource center in your area. You could also see a therapist. I offer free consultations for those people who just don't know where to start. If you're not where I am in this general area, seek out someone in your area. See if you can talk with a therapist so that you can get some guidance on where to go, where to start, what you need, and how to go forward. Those people who came to my workshop were given a handout with codes on how to schedule a workshop with me, a consultation with me, but I will include that in the notes for this recording. But whether you come to me or to a therapist in your area or another professional, I just want you to get help and make sure that you stay active. Please don't wait to fall and break a hip before you start working on this. If you are active in the community now, that's awesome. I want you to up it a notch if you can. I want you to stay that way. Being proactive is so much easier preventing injury than treating the injury later. So I hope this little presentation has given you a little bit of insight and helped you figure out what to do. Because if you do nothing, what's going to happen? What is that going to look like for you? Are you going to push yourself hard enough? Or are you going to push yourself too hard? You know, there's something to be said for having a professional help you through this. It's not necessarily as easy as it looks, but we're here to help you. So if you have any questions for me, please feel free to reach out or reach out to a professional in your area. Just get moving.